Hello, I'm Matthew Kaufenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to continue our three-part series on night pain, discussing specifically the hip. There are two sources of pain at the hip that can cause pain at night. One of them is called the bursa, and the other is actually some deep hip muscles. Now, if any of you are suffering from night pain, it is highly recommended that you do talk with your doctor to try to determine that source of that pain. If that pain is musculoskeletal, a physical therapist might be able to help. Now, the pain that we're talking about today is called hip bursitis. That pain really lies right on the outside of that hip, and it can come down the outside of that leg at times. And usually what happens is people just struggle lying down on that side, and it just becomes incredibly painful to sleep because they can't lie down on that side. So if we look a little closer at the anatomy, I'll just do a quick drawing here. This triangle is going to represent that pelvis, and then the lines down here are going to be that leg bone, also called the femur. The bursa itself, in essence, sits right here. So this blue is going to represent that bursa. And what will happen in this condition is that bursa will get irritated, it'll get inflamed. And there are a couple of reasons why it'll get inflamed, and I'll get to that in a second. The muscles that sit in that area are some deep hip muscles that run right along the rim of the pelvis, and they wrap themselves around, and then they come also into this direction and attach into that long leg bone called the femur. Now, the reason for this particular pain is, one, that bursa can get squished, or that bursa can get really highly irritated. And that'll usually happen in a condition called lateral pelvic tilt. What I mean by that is when we walk, what'll happen, when we put weight down onto one leg, we have to have enough strength in our core muscles. We have to have enough strength in our stomach and these deep hip muscles to keep our pelvis level. If there isn't enough strength, what'll happen is that pelvis will tilt. It'll tilt laterally. So again, here's the pelvis. It is now tilted in this direction. And if that happens, we now have the bursa that still is sitting here. But those muscles that run on the outside here now have been really stretched. And when they get stretched, they do this. They basically collide right into that bursa. And that bursa then becomes irritated and it becomes highly inflamed. The other source of pain in the hip at night is going to be these muscles. Those muscles, number one, are getting stretched a little too much here, but also what will happen if there's a problem at the foot, if people have incredibly flat feet, what will happen is this bone, this large femur bone, will actually rotate in a direction that you don't want it to. So what will happen is this bone will rotate inward. When it rotates inward, this muscle, that deep hip muscle, gets stretched. So if you have flat feet, what will happen is that muscle, with every single step you're taking, that muscle is getting stretched and stretched. If you look at my leg, when I land, I should land with a perfectly straight leg. However, if you have incredibly flat feet, you land and you rotate inward. And you can look at that leg. Look exactly what happened to that leg. It went here and it rotated inward. It rotated in. That muscle is getting stretched every single time that I step. It then breaks down. It ends up with small little tears. That becomes inflamed and that becomes highly painful. You then struggle with lots of night pain because, again, it's very difficult to lie down on that particular side. Thank you very much for listening. If you are struggling with night pain at the hip, at the shoulder, wherever it may be, please give me a call. I would certainly like to take a look at you, see if there's any way that I might be able to help. Please call me at 218-346-2464. Next time we'll conclude our three-part series and we'll talk about carpal tunnel.